Good morning. Today we are going to read about the Potency certificate. So before we start, I want to revise some of the definitions. So what is impotence? Impotence means physical inability of accomplishing the sexual intercourse. Then we have the next term, that is sterility, that is inability to procreate or conceive children. The other term which is commonly associated with females in connection with impotence is frigidity, where there is absence of desire for sexual intercourse in female. So impotence is a condition where there is inability to engage or to perform sexual intercourse. In males, it manifests as erectile dysfunction of penis, whereas in females, it manifests as vaginismus. This impotence is seen in both male and female, more commonly or easily diagnosed in males as erectile dysfunction of penis. In female, it is less commonly diagnosed, but it is seen in both the sexes, like male and female both. In female, it manifests as vaginismus, that is vaginal or pelvic pain, as well as the tenderness, which we see during the sexual encounter. So frigidity is the cold feeling, where she does not have any desire for sexual intercourse. Coming to the next term, that is sterility. Sterility is inability to procreate or reproduce. In males, sterility is when he is unable to impregnate a female, and in female, we call a female a sterile female when she is unable to conceive pregnancy. So sterility is inability to reproduce, whereas impotency is inability to engage in or to perform sexual intercourse. So sterility is to inability to procreate a child in male and inability to conceive a child in female. The terms which I told earlier, that is frigidity. Other term that you can use synonymously with frigid woman is cold female, where she does not have any sexual desire. Then we have another term, that is quadha. What is quadha? It is a male who is impotent to a particular female, whereas with other female he is potent, but to a particular female he is impotent. Then it is termed as quadha. Quadha, a male impotent to a particular female, with others he is well potent. So impotence in male is the persistent inability to develop or maintain penile erection sufficient to conclude coitus to orgasm as well as ejaculation. We have other terms in connections with impotence are impotence ejaculandi, where there is failure to ejaculate, ejaculatio precox, where there is premature ejaculation, and orgasmic anhedonia, that is ejaculation without orgasm. So since we are reading this topic under forensic medicine, we have to know some of the legalities that are associated with impotence. So in civil cases, it comes into play in during various cases like nullity of marriage, divorce, claims for damage, disputed paternity, and legitimacy. So it's nullity. So impotency is a ground for nullity of marriage, whereas sterility is not a ground for divorce. Whereas Impotency is a person, if a male is important or female is important, then there has never been an establishment of sexual intercourse or coitus, then that marriage can be nullified. Disputed paternity, how? If in order to know if the female is pregnant, who impregnated her? So in that case, also impotency comes into play. If one male says, I am impotent and I cannot make her pregnant, and the female is like, no, he is the father, then the disputed paternity thing can here be solved using impotency as a term. Then we have claims for damages and divorce, as I have already explained. Then comes the criminal cases. Criminal cases like rape and unnatural sexual offenses. Also, individuals becoming impotent due to an injury. This comes under grievous injury, where one of the clause is emasculation. So that constitute criminal cases. Now comes the causes of impotency. We have the anatomical causes, neurogenic causes, vascular causes, endocrine causes, trauma, drugs, temporary diseases, chronic lead and arsenic poisoning, X-rays, and aging. These are the organic causes. Ne- Neurogenic, like some of trauma to head, or trauma to spinal cord, or Tape's dorsalis, or chordae equina. Then endocrine, like diabetes, drugs like cocaine, heroin, and tranquilizers. General diseases like diabetes, hypertension, tuberculosis, all these can also lead to impotence. So coming to age as a factor, a boy below the age of puberty is sterile but not impotent. So age, if you see, ability of erection and coitus may be present earlier in puberty. So erection and coitus may be present earlier. That means he is potent. He can still engage in sexual activity, but he is sterile. He cannot produce kids, cannot produce children. So a boy below the age of puberty is sterile but not impotent. So we have other causes like developmental defect and abnormal conditions. Like in penis, we have absent penis, that is infantile penis, hypospadias, then epispadias, with Peyronie's disease. In testis, either the testes are not present or it is cryptopyrism, that is undescended testis. So if we go by terminology, hypospadias, when the urethral opening is present above the glans, below the glans penis, is hypospadias. And when the urethral opening is present above the glans penis, that is epispadias. And Peyronie's diseases, bent penis. Okay. So these causes impotency. And hypothyroidism is undescended testes. Earlier, the testis developed in abdomen. Then it passes through inguinal canal and goes to the scrotum. So if the testis remains in the abdomen and does not descend into the scrotum, that condition is known as hypothyroidism. So this I was talking about where the urethral opening is present below the glans penis, that is hypospadias, and then the urethral opening is present above the glans penis, that is known as epispadias. So here, as you can see, it is below the glans penis, and here it is above the glans penis. So hypospadias and epispadias prevents the proper deposition of semen and vagina, causing impotency. And when proper deposition does not happen, then it can also lead to sterility. So then comes the local diseases. In males, we have gonorrhea. This is a sexually transmitted disease that is caused by Neisseria gonorrhea, elephantiasis. Other name is filariasis. This is the lymphatic obstruction of the lower limbs by Culex mosquito. Then we have hydrocele. It is hydrocele when there is water accumulation on the testis. Then we have phimosis and paraphimosis. Adherent prepuce, cancer and sarcoma. So phimosis is inability to retract the foreskin over the glands. And paraphimosis is retracted foreskin can't be replaced back over the glands. So phimosis is inability to retract the foreskin over the glands, and paraphimosis is inability to replace the retracted foreskin over the glands. So this is hydrocele, where fluid gets accumulated down the testes. Now, as we read, all these conditions causes impotency. Like gonorrhea, syphilis, cancer, hydrocele, phimosis, and paraphimosis. Then we have neurological causes, right? Hemiplegia, paraplegia, syringomyelia, Age dorsalis, disseminated sclerosis, and multiple sclerosis. So, all these conditions, the nerve supply to the lower part of the body gets hampered, leading to erectile dysfunction in males. So, injuries like head injury, spinal cord injury, equina injury, vertebral injuries causing impotency because of nerve supply to the lower limbs gets hampered, leading to erectile dysfunction in males. Other conditions that can cause impotency are syphilis, trauma, head injury to occipital region, fracture of the lumbar vertebra, fracture of the pelvis, surgical trauma, amputation. Exposure to X-rays is temporarily causes azoospermia. That is left in the sperm clot. Then spermatic cord clot, either by disease or by operation. Then we have the general diseases like TB, diabetes, chronic nephritis, and tuberculosis. Diabetes, these all conditions are treatable. So temporarily it causes impotency. Once they are treated, person can after that become potent. So we have the generalized condition of diabetes, tuberculosis, chronic nephritis. Diabetes affects the peripheral arteries, ultimately leading to disease and progressive weakness, depression, and leading to impotency means. And cancer, antidepressant, major tranquilizers, the androgens and preference. So these tranquilizers are drugs, act on smells, and which try to treat fear, pressure. These are psychoactive drugs. Another thing that is most commonly associated is body. So what is body? Where immune is important to the particular feeling, not to all the feelings. That condition is known as body. So psychological causes like guilt, anxiety, excessive masturbation, performance anxiety, reinforcement, and psychiatric so the guilt sense of sexual intercourse causes impotency and sterility. And sexually satisfaction is not through vaginal dude, but through other activities like exhibitions, the various sexual perversions of exhibitionism, where the sexual festism or masochism or sadism, where the being takes patients, where the person said. So all these actually what she's she's like vasectomy and organ this will cause impotence. It's a complete amputation of the penis is leading to and impotency, whereas conditions like vasectomy and orchidectomy causes sterility. Then this is the notes to remember impotency conditions. So we have the mnemonic for the various causes of impotency. So impotence, I for inflammatory, example prostatitis, M for mechanical, example is Peyronie's disease, P for post-surgical, example radical prostatectomy, O for occlusive vascular, example arteriosclerosis, T for traumatic, example is pelvic fracture, E for endorescence factors, that is chronic renal failure, N for neurogenic, that is multiple sclerosis, C for chemicals, antihypertensive, E for endocrine, that is diabetes mellitus. So these are the possible causes of erectile dysfunction. Next is how do we differentiate between organic and the psychogenic causes. So psychogenic, the onset will be sudden and there'll be inconsistent loss of erection will be seen. Early morning erections will be seen in psychogenic. Libido is drive for sex, sexual drive will be present. So libido problems will be there in psychogenic and the age will usually be less than 60 years. So libido is sex drive. So in psychogenic there is a problem, whereas in organic there is no problem with the sex drive. The libido is normal. So the organic we see onset is gradual, loss of erection is consistent, early morning erections are not seen. Libido, as stated earlier, it's normal. Age will be more than 60 years. So organic causes, organic 80%. Examples like peripheral vascular disease, diabetes mellitus, neurological conditions like pelvic surgery, spinal injury, multiple sclerosis, side effects of drugs, smoking, alcohol, all these things will lead to impotency in a male. So psychogenic causes will be performance, anxiety, depression, first night performance creates anxiety, leading to one of the causes for impotency, fear for intimacy, or lack of interest in the partner. There is something known as impotence boredom, where some individuals may be impotent with only a particular woman, but not with others. So the examination, in the examination part, how do you investigate such a case? There is testosterone insufficiency, biochemical investigations can be done. Then NPT test, that is nocturnal penile tumescence and rigidity test can be done. NPT test helps to differentiate between psychogenic and organic causes. So if NPT is positive, that means psychological cause is there. If it is negative, then organic cause should be looked for. And it also it also looks into uh, erections during REM sleep, that is early morning. Then we have serum, measure the serum testosterone and prolactin. So if there is hyperprolactinemia, then GnRH, that is gonadotrophin releasing hormone, is suppressed. That leads to suppression of the LH and FSH. That leads to decrease in the testosterone production. So serum testosterone and prolactin level should be checked. Then we have something known as duplex Doppler ultrasonography. So Doppler ultrasonography, it consists of D-scan ultrasonography where we look for the anatomy of the testis, and then we have Doppler scan where the blood flow, uh, either it is going towards the penis or away from the penis, the color change will be seen. So we have duplex Doppler ultrasonography. Then we have the psychological test, that is mental test. Then referral in such patients, you can either refer them to a urologist if there is a vascular problem, or endocrinologist if there is a hormonal abnormalities, or psychiatrist and a psychosocial counselor if there is any psychosocial problems is present. Then we have what are the causes for impotency in a female? In a female, we see female is always a passive agent. Okay, so before puberty and after menopause, she's sterile because the eggs are not developed so as to leading to pregnancy. So she is sterile before and after menopause. Uh, Other conditions like defective development, we have the absence of vagina, infantile vagina, and in, intact labia majora. So if there is no vagina or there is infantile vagina, then these developmental defects can lead to impotence. So absence of vagina, Turner syndrome is X0, and such females are mostly infertile. Okay. So the absence of fallopian tube, ovaries, and uterus will make her sterile. Whereas if there is occlusion of the vagina or there is adhesion of the labia, then in that condition she will be impotent but not sterile or imperforate hymen. If the hymen is intact, um, if the hymen is not broken, then the semen or the sperms can't pass and travel to the uterus and fallopian tube and lead to fertilization. So this is a treatable condition. Imperforate hymen is there, and that gets treated. Then she can become potent after the treatment. So there are two types of condition. Either there is a temporary impotency and permanent impotence. So these are like temporary impotence. So the absence of uterus, fallopian tube, and ovaries leads to sterility. Then we have the local diseases like gonorrhea. Gonorrhea is an STD, that is sexually transmitted disease. So gonorrhea of the cervix, uterus, ovaries, fallopian tube, obstruction of the fallopian tube, disorders of menstruation like dysmenorrhea and all, rectovaginal fistula, prolapse of the uterus, vulval and vaginal tumors. All these local conditions can also lead to impotency in a female. Then other causes like occupational exposure to lead and X-rays and drug dependent. If there is prolonged exposure to drugs like cocaine, heroin, then that can make her sterile. Plus, prolonged exposure to alcohol can also make her sterile, as alcohol has become very common on females these days. So now we have vaginismus. As told, it is one of the causes of impotency in a female. So, what is vaginismus? Here, you feel the pain. Pain will be present during when you try for coitus. That time, the pain will be there. Then this is a psychosomatic illness and felt at various levels of the constrictions of levator ani muscle, right up to the vaginal orifice. So, right from the very varying constructions of the levator ani right up to the vaginal orifice, we can see the pain can be felt. Okay. So that condition is known as vaginismus. What exactly? It's like a cramp-like pain would be there. Cramp-like spasm of the adductor muscles. Then psychological conditions like fear and guilt sense and dislike for the partner can also cause impotency but not sterility. Because in such a condition, she can still conceive a child, she can still give birth to a child, but since she doesn't like the partner, then intimacy is not happening. So this is causing her impotence. That means she's not engaging into sexual intercourse or coitus. Then how do we examine a male for potency? Before that, I'll just like to tell what marriage is. So marriage is a contract between a man and a woman. So the man is more than 21 years and the woman is more than 18 years. And the very basic thing that is needed, that is there in the this contract, marriage contract, is that the female gives an implied consent for sexual intercourse. So if there is no consummation of marriage. No consummation has happened between a male and a female, then that marriage becomes nullified or null and void. Whereas even after marriage, if there is no coitus that has happened between male and female, that leads to nullity of the marriage. Whereas even after marriage, she has she is engaged into coitus, but she has not given a birth to a child. Then in that case, nullity of the marriage is not there. So nullity of marriage, if you see, like a marriage can only be nullified when either partner is either underage, or one partner is of unsound mind, or one is already married, or one when the marriage was not consummated due to impotency, and when she was already pregnant with another man at the time of marriage. So the consummation is first single act of full or complete penetration of vagina by the fully erect penis has to happen. So consummation occurs only when there is at least single act of penetration of vagina by a fully erect penis after marriage. Then only consummation of marriage occurs. So in males, the sexual act comprises of erection, penetration, ejaculation, and emission. So the common situation wherein such examination is carried out is criminal cases we have rape, adultery, and unnatural sexual offenses. Whereas now the adultery has been uh, removed as a crime. Previously, it was considered as a crime where a male was engaged with a female who is already married to another person, and he is having a relationship with that female. Then that was considered as a crime where only males were punishable. So now this section has been removed from offense. So nullity of marriage happens when unconsummated marriage is there. Unconsummated means not a single act of coitus has happened between the male and the female. And disputed paternity, where uh, female says that the child is is born because of coitus with the ex-male. But the ex-male claims that he's sterile or he's impotent, and so he can't be the father. So in that disputed paternity cases, this examination becomes important. And claims or damages arising from the injuries resulted in impotency. There is one subsection under grievous injury known as emasculation, where you read about injury that resulted in impotence. So the guidelines will be examination has to be taken on authorization by a competent authority, and police officer or magistrate inquest is required. If a person is arrested, examination without consent can be done by applying reasonable force, because in that case the consent is given by law. So a reasonable force can be applied and the examination can be carried out. So the medical history, habits like smoking, alcohol, drugs, all these medical history should be taken, like diabetes is there or not, trauma like head injury, amputation of the penis, or spinal injury, if something like this has happened in previous few years, or previously it has ever happened. Venereal disease like syphilis in a tertiary stage. So for checking for syphilis, we do VDRL test, venereal disease laboratory research test. So hypertension and occupation, what occupations like painting, of those who are painters, they're often exposed to lead that can also lead to neuropathy. Then history of the sexual development, history of masturbation, night emission, morning erection of penis, or if there is any homosexual practice that the person is doing in the past, or there is history of any sexual intercourse, libido. Libido means sex drive. So sexual development of the organs and marital status. If he's already married, not married, then history related to local diseases like congenital abscess of penis or infantile penis, amputation of the penis, large hydrocele, or any endocrine disease like hypopituitarism, CNS disorders like syringomyelia, Tape's dorsalis, cauda equina. Then the so first you do the preliminary examination where you take the name, age, sex, consent is taken, date and time of examination is taken, then inquest from where you have received, which police station and all. Then you take the previous medical history of the person where you look for all those history that we have, syphilis or any CNS disorder or any trauma, any jet flights like diabetes, any endocrine uh, disorders are there. After that, you come to the physical examination, height, weight, build, hair, pubic hair, and all that thing. Next is the local examination of the penis, where it is present or whether present or not, development, adult size, infantile, length and circumference, anomalies, if there is any evidence of disease, foreskins, either it is retractable, non-retractable, like phimosis and paraphimosis we saw, then glance, penis sensation is present or not, and injuries, if any. Then scrotum whether it is pendulous or non-pendulous, testis present or absent, epididymis, or there is any evidence of STD, gonorrhea, syphilis, urethral discharge is present or not. And then you have a bulbocavernous reflex that is squeezing the glans, penis, and you see for the anus, you contract. Then you have cremasteric reflex. Cremasteric reflex is on the anterolateral, anteromedial part of both the thighs. You that hammer backside you give a stroke, knee hammer backside strength. Like you use that to put a stroke in that anteromedial side of the thigh, and you check for the upliftment of the testis, whether it is present or not. So master reflex is there or not there. Then you have the psychological evaluation, like if there is any anxiety, fear, or fort, hunger, depression. All these things are seen for the psychological evaluation. Then systemic examination, the CNS waste respiratory to investigations for sugar and VDRL. VDRL is done for syphilis, and then X-ray spine, pelvis system, then LFT to diagnose liver failure. These are the same causes. Mm, Then we have the investigation. You give intracavernosal injection to of papaverine. Papaverine is a vasodilator. So when you inject it, it will cause the erection of the penis. So that also has to differentiate between vascular cause and the cytogenic cause. Then already explained about the duplex Doppler examination and psychological evaluation. So opinion we does not give in a direct language. The psychogenic impotence cannot be ruled out by the physical examination, and certificate is usually given in a double negative form. That is, there is nothing to suggest that the above person is incapable of performing the sexual act, or the above subject is incapable of performing the sexual act because of the following reasons. After investigation, that you come to know. So it is either the person, there is nothing to suggest that the person is incapable of performing it, or the above person is incapable of performing the sexual act. Thank you.